Hi, I'm Judy Gaman and welcome to Fireside Chat with Judy Gaman. And I am your host and I have Dr. Walter Gaman here with me today. And one thing that we've been doing is we've actually been meeting with different groups. A lot of social groups and a lot of business groups are now going to Zoom meetings. And we've been going into those Zoom meetings and doing some Q&As over what's going on, some best health practices, even how to manage your stress. So if you are in a group like that and you'd like us to join you, we're more than happy to. During this time, really, we're all in this together, and anything we can do to help ease fears, to talk about things, maybe even cures that are coming, hopefully, and some testing, we're happy to do so. But today was an interesting meeting.
It was.
And I wanted to kind of go over some of the things that came out in today's meeting. We had one this morning early, and some of the questions were really good. But one of the things that was asked and kind of seemed to be a theme was what can people do within their own health to basically protect themselves at times when they're going to the grocery store, maybe they have to run to the bank, or they have things they have to do and it's unavoidable.
Well, the first thing they have to do is wear a mask. It's very, very important to wear a mask. The COVID-19 virus is spread by droplets, and it can even be aerosoled in big winds. So wear a mask. This is the number one thing. Number two, try and stay 6 feet away from other people. The reason for 6 feet is because the droplets go about 6 feet when someone coughs or sneezes. Don't be embarrassed to disinfect your shopping cart at the grocery store. Most grocery stores have disinfectant wipes. Wipe down your grocery cart or bring your own.
Yeah.
And feel free to wipe down other things. When you get home, change your clothes, shower, get everything under control so that there's very little possibility of contamination.
And one thing that I think is really important, if you own a business and you are in a service industry, like say plumbing or air conditioning or something where you actually have to go into people's homes because there is a need that can't wait. If you own that company, you really need to be extra careful that you've trained your employees on this and tell them not to be offended, but to take these extra precautions and even be aware that they're going into somebody's house and these people may actually be nervous that somebody's coming in, and remember, when they enter your house, it's just like you went to the grocery store. Put on your own mask, request that they wear a mask, maybe even have them wear gloves when they come in, and then after they leave, wipe everything down and treat it like you would if you were going out, because we want to mitigate as much as possible.
And if you wear a mask, the mask goes over the nose and the mouth.
Right, it's funny how many people don't wear their mask right.
I have seen so many people with their noses hanging out. You actually breathe more through your nose than your mouth. Please cover both.
That's right. And there have been a lot of questions, and this morning on one of the Zoom calls that we were on, this actually came up. People needed to understand, what do these numbers mean on these masks and what are these masks? So wearing a cloth mask is better than no mask. Going to a surgical mask is oftentimes better than a cloth mask. And then you get into N95s and N99s. So you want to explain to them the difference between an N95 and an N99.
Sure. I mean, N95 filters out 95% of particulate matter, including viruses above a certain size. And N99 filters out 99%. So that's the difference there.
Yeah, and the higher the number, the better, obviously.
Right. One question that I was asked, I'd like to comment on again, and that is, someone said, well, the number of deaths we have had so far are similar to the yearly deaths we get from influenza. So what's the big deal? Why aren't we overreacting? And they don't understand, or I did make them understand, if we had not practiced the social distancing and everything else that we're doing, we'd be talking about 1 to 3 million deaths, not 10 to 20,000 like we do with influenza approximately. So that's the difference, and people need to understand it. Don't treat this flippantly. This is serious.
And we talked before about some of the things that are coming out, like antibody testing. Now, there is an antibody testing that's coming out of IgG and IgM, but don't expect that your doctor's offices are going to have it right away. Executive medicine has ordered theirs. They're on back order. Think about this, the entire country, the entire world wants these tests, and we're all gonna get them as soon as we humanly possibly can get them, and we'll let you know. We'll keep you abreast of when those are here, when they're ready, when they're available. But just because you hear something is here or it's coming and it's gonna be available, doesn't necessarily mean that it's available right around the corner from you.
Right. New therapies today. Today is April 9th. 2020. It was announced today that trials have started giving the serum of people that have recovered from COVID-19 to ill people, and they're having good results. There's ongoing studies about the hydroxychloroquine plus Zithromax. We don't know the results of those. Vaccine trials are starting up soon. One optimistic report says we'll have it by the end of the year.
Yay!
Pfizer is one of the companies that's testing a vaccine, and also they're testing Xeljanz, a drug they use for psoriasis as a treatment. The idea there is to control the inflammation related to COVID-19, because when the lungs fail, it's usually a massive inflammatory response, not an actual infection at that point. So a lot of exciting things are happening. We will beat this virus. We will crush it. We will kill it. We will get rid of it.
Yeah.
It's just a matter of time. The United States may have been slow to act on this, but once we're hit in the head with something, look out, world, because there's no one better than the U.S. to react and kill things.
To react and kill things.
Yes.
but to protect its people. And I think it goes without saying that we need to be very mindful. There's a lot of blame game, a lot of finger pointing. This is not something that anyone in our time has seen before. And I would hate to be the person responsible for how to react. We don't know how to react. This is a first-time thing for all of the leaders around the world. One thing that I am very, very proud of is how we're sharing information. We have a lot of scientists working, a lot of companies, industry, private doctors. I mean, just this week, Walter, you've had some amazing things that have come across because the doctors get alerts before you see it on the news, and that doctors sharing what's going on. There's some amazing information coming out of Spain. And this kind of sharing and this kind of collaboration actually may work out to everyone's benefit, because we're gonna see things, other things besides COVID, maybe eradicated. And we're probably gonna see much lower numbers of deaths from the flu, for example. Because one of the great things about the techniques that we've learned about COVID is, I would dare to say that future flu seasons will not be like past flu seasons.
Well, the people who die from the flu, the same thing happens. They get a massive inflammatory response on their lungs, getting something called ARDS. So if we find a way to treat COVID, it will be a way to treat the flu also.
Well, I just want to end with, I have such a good feeling about this week, and I know lots of people do. And this is spring, it's a time of new awakenings, it's a time of renewal. I know lots of wonderful things are happening out there amongst all the horrible things that are happening. And if we can all just embrace the good things that are gonna come about of this. One thing, Walter and I are in school at Harvard, and one thing our professor said tonight, which was so profound, is that we really need to pay attention to the goodness that's happening, but also all of the innovation that is going to propel our world because of this. And he says he turns on the news each morning. He's not expecting bad news. He turns it on because he knows any minute there's going to be great news, and we're all going to be rejoicing over great news. I think that's coming very soon, and that's just the way I see it.